Every single morning, millions of people around the world do something they believe is protecting their health, but they might be making one of 10 critical mistakes that silently sabotage every single reading. And here's the kicker. Your doctor might never even tell you about them. I'm Dr. Leonid Kim. Today, we're diving deep into something that affects over 1 billion people globally, high blood pressure. But this isn't another boring lecture about eating less salt. No, I'm going to reveal the 10 most common, most dangerous mistakes people make when measuring their blood pressure at home. Mistakes that can make your numbers look way higher than they actually are, or worse, way lower. And if you get this wrong, you could be taking medication you don't need, or worse, missing a problem that's quietly damaging your heart, your brain, and your kidneys. Most people get this wrong, and they don't even know it. By the end of this video, you'll know exactly how to measure your blood pressure like a true medical professional. We'll cover 6 key insights: the hidden timing mistakes, the body position errors, the equipment traps, the psychological factors, the biological rhythms most people ignore, and the one surprising mistake that even nurses make in hospitals. Here's what most people don't realize. Mistake number 1 is something I call the white coat rush. Here's the scene. You wake up, you remember you need to check your blood pressure, so you roll out of bed, shuffle to the bathroom, chug some water, maybe check your phone for notifications, and then immediately wrap that cuff around your arm. Stop. Right there. Your blood pressure isn't a static number like your height. It's a living, breathing measurement that changes moment by moment. When you first wake up, your body is in a completely different state than it is even 30 minutes later. Your nervous system is booting up. Your stress hormones are circulating. Your heart is adjusting from sleep mode to awake mode. But here's the surprising part. Most people don't wait long enough after any activity before measuring. Did you just walk up the stairs? That can spike your systolic pressure by 20 points or more. Did you just have an argument with your spouse? Emotional stress triggers a flood of adrenaline. That internal fire we call inflammation, and your blood vessels constrict like a clenched fist. The real biological mechanism here is fascinating. When you're active, your sympathetic nervous system, the fight or flight system, is engaged. It releases norepinephrine, which acts like a messenger telling your blood vessels to narrow. Narrow vessels mean higher pressure. It's like trying to push the same amount of water through a garden hose that's been squeezed tight. The pressure has to go up. So what's the fix? You need at least 5 minutes of complete rest before measuring. And I mean rest, not scrolling through emails, not watching a stressful news segment. Sit quietly. Breathe normally. Let your internal fire cool down. Let your circulation settle into its natural baseline. Most people get this wrong because they think rest means not exercising. But mental rest matters just as much as physical rest. Mistake number 2 is what I call the cuff position catastrophe. And this one is so common it makes me want to pull my hair out. Here's the thing about blood pressure cuffs. They measure the pressure in a major artery called the brachial artery, which runs down your upper arm. But your heart isn't in your arm. Your heart is in the center of your chest. So for the measurement to be accurate, the cuff needs to be at the same level as your heart. Most people get this wrong. They let their arm hang down by their side, or they rest it on a table that's too low, or they prop it up on a pillow that's too high. When your arm is below heart level, gravity pulls more blood into that arm. It's like holding a garden hose lower than the faucet. The pressure builds up. This can falsely elevate your reading by 10 to 20 millimeters of mercury. That's the difference between normal and stage 1 hypertension in many guidelines. But this is where it gets interesting. When your arm is above heart level, the opposite happens. Gravity works against the blood flow, and your reading comes out artificially low. You might think your blood pressure is perfectly controlled when it's actually creeping into dangerous territory. The surprising part is, even a difference of 1 inch matters. 1 inch! That's less than the width of your thumb. Here's the simple fix. When you're seated, rest your arm on a table or armrest so that the middle of the cuff is exactly at heart level. A good way to check? The cuff should be roughly at the level of your sternum, your breastbone, not higher, not lower, exactly there. And while we're talking about position, your arm should be supported. Don't hold it up with your muscles tensed. Muscle tension sends signals through your nerves that can trigger that internal fire, inflammation, and cause vessel constriction. Supported arm, relaxed muscles, heart level. That's the trifecta. Mistake number 3 is the one and done fallacy. This is probably the most widespread error I see, and it's so easy to fix. Most people take one reading, look at the number, and either panic or celebrate. Oh, 140/90. I need to call my doctor. Or 120/80. I'm perfectly healthy. Here's what most people don't realize. Your blood pressure naturally varies from heartbeat to heartbeat. It's not like weighing yourself on a scale. It's more like measuring the waves in the ocean. Each wave is slightly different. In fact, studies show that consecutive blood pressure readings can vary by 5 to 10 points just due to normal biological fluctuation. Your breathing changes. Your digestion is happening. Your muscles make tiny adjustments. Your nervous system is constantly fine-tuning. The surprising part is, taking just one reading and making decisions based on it is like tasting one bite of soup and deciding the entire pot needs more salt. You need multiple samples to know the true flavor. Here's the proper technique. Take 2 readings, 1 minute apart, then average them. If the first 2 readings are very different, more than 10 points apart, take a third reading and average all 3. But wait, there's more. Don't just do this once a day. Blood pressure has a natural rhythm. It's typically lower in the morning, rises through the day, and may dip again in the evening. Some people even have a phenomenon called non-dipping, where their pressure stays high at night, which is actually a bigger risk factor for heart problems than daytime pressure. So measure at the same times each day, morning and evening, for a week. Then look at the trends, not individual numbers. This gives you the real picture of your cardiovascular health. Mistake number 4 is the wrong cuff size trap. And this one is more common than you think, especially with those cheap drugstore monitors. Here's the biological reality. Blood pressure cuffs work by inflating to a pressure that temporarily stops blood flow in your artery, then slowly deflating while listening for the return of blood flow. The cuff needs to compress the entire width of your arm evenly. If the cuff is too small for your arm, and I'm talking to you, my friends, who lift weights or who have a larger build, the cuff can't compress the artery properly. It's like trying to wrap a rubber band around a watermelon. It doesn't distribute pressure evenly. The machine thinks your pressure is higher than it actually is. Studies have shown that a cuff that's too small can overestimate blood pressure by 10 to 30 points. That's massive. That could push someone with normal blood pressure into the hypertension category, leading to unnecessary medication, unnecessary side effects, and unnecessary anxiety. But this is where it gets interesting. The opposite is also true. A cuff that's too large for a smaller arm can underestimate blood pressure. You might walk around thinking your numbers are fine when they're actually climbing into the danger zone. Most people get this wrong because they assume one size fits all. It doesn't. Here's how to check. Wrap the cuff around your bare upper arm, about an inch above your elbow. There should be a marking on the cuff that shows where the artery indicators should line up with your brachial artery. But more importantly, the cuff should cover about 80% of the distance from your shoulder to your elbow. If it's much shorter or much longer, you need a different size. If you have an arm circumference over 13 inches, you probably need a large adult cuff. Over 17 inches, you need an extra large cuff. Don't guess. Measure your arm with a tape measure. Your accuracy depends on it. Mistake number 5 is something I call the full bladder blind spot. And yes, I'm talking about needing to use the bathroom. This one sounds almost too simple to be true, but the science is rock solid. When your bladder is full, your blood pressure goes up. Period. Here's the biological mechanism. A full bladder triggers your sympathetic nervous system, that same fight or flight system we talked about earlier. Your body interprets a full bladder as a stress signal. It releases stress hormones. Your heart rate increases slightly. Your blood vessels constrict. It's your body's way of saying, hey, deal with this situation. Research published in medical journals has shown that a full bladder can increase systolic blood pressure by 10 to 15 points. In some people, especially older adults, it can spike even higher. The surprising part is, most people never even think about this. They measure their blood pressure first thing in the morning without using the bathroom, or they measure it in the evening after holding it through a long meeting. And then they wonder why their numbers are erratic. Here's the fix. Always empty your bladder before measuring. It's not just about comfort. It's about biology. Your bladder and your blood pressure are connected through nerve pathways and hormone signals. When one is stressed, the other responds. And while we're on the topic of bathroom habits, avoid measuring right after a big meal. Digestion requires blood flow to your stomach and intestines. Your body redirects circulation, and your blood pressure can fluctuate during this process. Wait at least 30 minutes after eating. Mistake number 6 is the talking trap. This one is so subtle, most people don't even realize they're doing it. Picture this, you're sitting in your chair, cuff on your arm, and your spouse walks in and asks, "What are you doing?" You answer. Or your phone buzzes and you say, "Just a second, I'm checking my blood pressure." Or maybe you're watching this video and talking back to the screen. Every time you speak, every time you engage your vocal cords, every time you form words, you activate muscles in your chest, throat, and abdomen. You change your breathing pattern, you engage your nervous system, and your blood pressure rises. Here's what most people don't realize. Even casual conversation can raise systolic blood pressure by 5 to 10 points. And if you're discussing something emotional, something stressful, that number can jump even higher. The biological mechanism is straightforward. Speaking requires coordinated muscle activity. Muscles need blood flow. Your heart responds by pumping harder. Plus, the mental engagement of conversation activates your brain, which increases overall metabolic demand. Your cardiovascular system responds accordingly. But this is where it gets interesting. It's not just talking to another person. Talking to yourself counts. Reading aloud counts. Even singing along to a song counts. If your vocal cords are vibrating, your blood pressure is likely higher than baseline. The fix is beautifully simple. Complete silence for 5 minutes before measuring and silence during the measurement itself. No phone calls, no conversations, no reading aloud, no talking to your pet. Just you, your breathing, and the cuff. Think of it as meditation with a medical purpose. Your nervous system needs to settle into what we call a parasympathetic state, the rest and digest mode. That's when your blood pressure is at its truest baseline. Mistake number 7 is the clothing barrier. And I see this one constantly, even in my own clinic. People roll up their sleeve, wrap the cuff over their shirt, and think, close enough, right? Wrong. Very wrong. Here's the science. Blood pressure cuffs need to make direct, firm contact with your skin to compress the brachial artery effectively. A layer of fabric, even thin fabric, creates a barrier. It absorbs some of the pressure. It distributes the force unevenly. It can bunch up under the cuff and create pressure points that confuse the sensor. The surprising part is, even a thin dress shirt can add 5 to 15 points to your reading. A thick sweater? You might as well be guessing. And if the fabric is bunched or wrinkled under the cuff, all bets are off. The reading becomes essentially meaningless, but this is where it gets interesting. Rolling up your sleeve can also be a problem. If your sleeve is tight and creates a tourniquet effect above the cuff, it can artificially lower the reading below the cuff. Your arm might look fine, but the circulation is being compromised. Here's the proper technique. Remove your shirt or wear a short-sleeved garment. If you must roll up your sleeve, make sure it's loose and doesn't constrict your upper arm at all. The cuff should sit directly on bare skin, positioned about 1 inch above the bend of your elbow. And here's a pro tip most people don't know. Take off your watch and any bracelets on that wrist. They can slightly affect circulation and nerve feedback, especially if they're tight. You want zero interference with your body's natural blood flow. Mistake number 8 is the wrong arm assumption. Most people have a dominant arm, the one they write with, throw with, lift with, and most people automatically put the blood pressure cuff on that arm. Here's what most people don't realize. Your dominant arm often has slightly different blood pressure than your non-dominant arm. Why? Because you've been using it more throughout your life. The muscles are slightly more developed. The blood vessels have adapted to different flow patterns. There may be minor differences in artery size and position. The surprising part is, for most people the difference is small, maybe 5 points or less. But for some people, especially those with certain vascular conditions, the difference can be 10 to 20 points. And here's the critical part. If you always measure the arm with the higher pressure, you might be overestimating your true cardiovascular risk. If you always measure the lower arm, you might be missing a problem. Medical guidelines actually recommend measuring both arms at least once, especially when you first start monitoring at home. If there's a consistent difference of more than 10 points between arms, you should mention this to your doctor. It could indicate something called subclavian artery stenosis, a narrowing of an artery under your collarbone. It's not common, but it's important to catch. But this is where it gets interesting. Once you know which arm reads higher, stick with that arm for all future measurements. Consistency matters more than perfection. You want to track trends over time, and switching arms introduces unnecessary variables. So here's your action step. Measure both arms today. Write down the numbers. Use the higher reading arm for all future measurements. And if the difference is more than 10 points, make a note to discuss it at your next medical appointment. Mistake number 8 is the wrong arm assumption. Most people have a dominant arm, the one they write with, throw with, lift with, and most people automatically put the blood pressure cuff on that arm. Here's what most people don't realize. Your dominant arm often has slightly different blood pressure than your non-dominant arm. Why? Because you've been using it more throughout your life. The muscles are slightly more developed. The blood vessels have adapted to different flow patterns. There may be minor differences in artery size and position. The surprising part is, for most people, the difference is small, maybe 5 points or less. But for some people, especially those with certain vascular conditions, the difference can be 10 to 20 points. And here's the critical part. If you always measure the arm with the higher pressure, you might be overestimating your true cardiovascular risk. If you always measure the lower arm, you might be missing a problem. Medical guidelines actually recommend measuring both arms at least once, especially when you first start monitoring at home. If there's a consistent difference of more than 10 points between arms, you should mention this to your doctor. It could indicate something called subclavian artery stenosis, a narrowing of an artery under your collarbone. It's not common, but it's important to catch. But this is where it gets interesting. Once you know which arm reads higher, stick with that arm for all future measurements. Consistency matters more than perfection. You want to track trends over time, and switching arms introduces unnecessary variables. So here's your action step. Measure both arms today. Write down the numbers. Use the higher reading arm for all future measurements. And if the difference is more than 10 points, make a note to discuss it at your next medical appointment. Mistake number 9 is the anytime works myth. This is where we dive into the fascinating world of circadian rhythms, your body's internal clock. Your blood pressure isn't random. It follows a predictable pattern throughout the day, controlled by hormones, nerve signals, and even the position of the sun relative to your sleep schedule. This is called the circadian rhythm of blood pressure. For most people, blood pressure dips by 10 to 20% during sleep. This is called nocturnal dipping, and it's actually protective for your heart and blood vessels. It's like giving your cardiovascular system a nightly vacation. During this time, your heart muscle recovers, your blood vessels relax, and inflammation, that internal fire, has a chance to subside. But this is where it gets interesting. Not everyone dips. About 20% of people and up to 50% of people with diabetes or kidney disease are non-dippers. Their blood pressure stays high at night. This is actually a bigger risk factor for heart attack and stroke than daytime blood pressure. Your heart never gets that vacation. The internal fire keeps burning 24/7. Most people get this wrong because they measure at random times. Monday morning, Wednesday evening, Saturday afternoon. They're comparing apples to oranges. A reading taken at 8 a.m. is biologically different from a reading taken at 8 p.m. The surprising part is, even the act of measuring can become part of your routine in a way that affects your numbers. If you always measure after your morning coffee, you're not measuring your baseline, you're measuring your caffeine response. If you measure after your evening workout, you're measuring your recovery state, not your resting state. Here's the proper protocol. Measure at the same times every day. The gold standard is morning, before breakfast, before medication, after bathroom, and evening, before dinner, before medication, after resting. Do this for a week. Keep a log. Look for patterns. Are you a dipper? Is your morning pressure consistently higher? Are there specific days when your numbers spike? This data is incredibly valuable. It turns your blood pressure monitor from a random number generator into a true health tracking tool. Mistake number 10 is equipment ignorance. And this is the one that even some healthcare professionals get wrong. Not all blood pressure monitors are created equal. That $20 monitor from the discount store? It might be accurate. It might be off by 20 points. You have no way of knowing unless you validate it. Here's what most people don't realize. Blood pressure monitors drift out of calibration over time. The sensors age. The tubing degrades. The algorithms that convert pressure waves into numbers can become less accurate. It's like a scale that slowly starts showing the wrong weight. The surprising part is, even expensive monitors can be inaccurate if they're not validated. The gold standard for home monitors is something called clinical validation. This means the device has been tested against the old-fashioned manual method, the stethoscope and cuff that doctors use, and proven accurate across a wide range of patients. Look for validation from organizations like the British Hypertension Society, the European Society of Hypertension, or the Association for the Advancement of Medical Instrumentation. If your monitor doesn't mention any of these, it's basically an unregulated guessing device. But this is where it gets interesting. Even validated monitors need regular checking. At least once a year, bring your home monitor to your doctor's appointment. Take a reading with your device, then have the medical assistant take a reading with the clinic's professional equipment. Compare the numbers. They should be within 5 points of each other. And here's something that changes everything. The position of the cuff tube matters. If the tube is hanging down, it can create a slight siphon effect that affects the reading. If it's kinked or pinched, the pressure won't transmit correctly. The tube should run naturally from the cuff to the monitor without tension or kinks. Also, check your batteries. Low battery power can cause erratic readings. Replace them regularly, even if the monitor still turns on. And if your monitor uses a power adapter, make sure the connection is secure. A loose connection can introduce electrical noise that confuses the sensors. Now, before we wrap up, I want to give you something extra, because knowing how to measure is only half the battle. You also need to understand what those numbers mean. Blood pressure is reported as two numbers, systolic over diastolic. The systolic number, the top one, is the pressure when your heart contracts and pushes blood out. The diastolic, the bottom one, is the pressure when your heart relaxes and fills with blood. Here's the analogy I use with my patients. Imagine a garden hose with a spray nozzle. When you squeeze the trigger, the water shoots out under high pressure. That's systolic. When you release the trigger, there's still some pressure in the hose, but it's lower. That's diastolic. Most people get this wrong. They focus only on the top number. Oh, my systolic is 140, that's bad. But the diastolic number matters too. It represents the constant pressure your blood vessels are under even when your heart is resting. If diastolic is consistently above 90, your vessels are under constant stress. That internal fire of inflammation is always smoldering. Your artery walls are being battered 24/7, not just during heartbeats. The current guidelines generally consider normal to be under 120/80. Elevated is 120 to 129 over less than 80. Stage 1 hypertension is 130 to 139 over 80 to 89. Stage 2 is 140 or higher over 90 or higher. But here's the surprising part. These numbers aren't absolutes. Context matters. If you're 70 years old, a systolic of 140 might be acceptable. If you're 30, it's concerning. If you have diabetes or kidney disease, the targets are lower. Your doctor will interpret your numbers based on your complete health picture. Let's quickly bust some myths that I hear constantly. If I feel fine, my blood pressure must be fine. Fact, high blood pressure is called the silent killer for a reason. You can feel perfectly normal while your arteries are being damaged. By the time you feel symptoms, headaches, dizziness, chest pain, the damage may already be significant. I only need to measure when I feel stressed. Fact, stress is just one factor. Your blood pressure can be high during completely calm moments due to genetics, diet, sleep quality, and dozens of other factors. Measure regularly, not just when you feel off. If my home monitor says I'm fine, I don't need doctor visits. Fact, home monitoring is fantastic, but it's not a replacement for professional medical care. Some conditions require specialized tests that home monitors can't perform. Use home monitoring as a complement to, not a replacement for, regular checkups. Blood pressure medication cures hypertension. Fact, medication controls it. It doesn't cure it. If you stop taking your medication, your blood pressure will likely rise again. Think of it like eyeglasses. They correct your vision while you're wearing them, but they don't fix your eyes. Let me give you the exact daily protocol that I recommend to my patients. Write this down. Step 1, choose your times. Morning and evening, same times every day. Set phone reminders if needed. Step 2, prepare your environment. Sit in a quiet room. Temperature comfortable, not too hot, not too cold. Extreme temperatures affect blood pressure. Remove tight clothing from your upper arm. Step 3, empty your bladder. Every single time, no exceptions. Step 4, sit and rest for 5 minutes. No talking, no phone, no television. Just breathe. Let your nervous system settle. Step 5, position yourself. I'm Dr. Leonid Kim. Take care of your health.